Hi, we're pioneers. Today, we're experiencing a health crisis, a global health crisis that a lot of countries are experiencing. This disease is having a big problem. One example of this problem is the problem of transportation. We're here to present our thesis proposal titled Comparative Analysis on the Access to Public Utility Vehicles Before and Since Pandemic and its Implications to the Transportation Industry and the Public Welfare. This study will show the comparison of accessibility of public utility vehicles before and during pandemic. This transportation is very useful for health protocols in business and to the people buying their essential needs. Since the COVID-19 pandemic affects the country, the government ordered to limit the public transport. During the lockdown, government banned the public transport in order to control the rapid spread of the virus. Many operators, both formal and informal, completely shut down the operation of the business for the safety of the commuters. Commuting and traveling will not recover when the city is under lockdown. These movements affect all the business and other source of income of the entire city. Due to lockdown, transporting the essential goods pulled down the demand. Balanga City is well known by famous establishments, local governments, agencies, tourist spots, colleges, and university, including the hospitals. The city is the center of transportation. Some public utility vehicles like tricycles, jeepneys, modern jeeps, buses, and private vehicles affects business meetings, agendas, and other gatherings in Balanga covered by transportation. The impacts of COVID-19 in transportation lowers the number of passengers in public utility vehicles down to 50%, and the fare rate lost 50% daily. Public and private operators decreased their income due to pandemic. Public services forced to reduce the number of vehicles to comply with the government requirements. Drivers and operators sanitized their vehicles to secure the safety of the commuters. Proper sanitation of floor mats, seats, handles, and installing plastics separators between driver and passengers to maintain the social distancing. Some companies modified or customized their vehicles for the pandemic and always counting the number of the passengers before leaving the terminal. The solution of this problem is to provide free transportation service in each municipality. As we see on the graph, we see the numbers of public utility vehicles before and during the pandemic. Before, 40 buses are roaming and operating daily, but now, during the pandemic, 16 buses only are allowed. Also in jeepneys, 50 units are operating daily, but the public terminal allowed only 20 units, same as the tricycles. Before, 2,380 units are roaming and operating, but by now, 1,190 units are allowed to operate daily during the pandemic.
Statement of the problem. When the pandemic started, one of the affected sector is transportation, including operators, drivers, and commuters, because public utility vehicles are banned to stop spreading the virus. When they are allowed to operate again, they are forced to reduce the vehicles and only 50% of passengers are allowed, and they are required to sanitize and put sanitation area on their units. Due to that, their income or revenue is decreasing. Instead of getting high income because the fare is 2 times increasing, they lost it by buying alcohol, food sanitation, or rubber mats, and installing barriers. Commuters are also suffering from increasing of fare, including the frontliners, patient, workers in private and public sector who doesn't have private vehicle and their only mode of transportation is through PUB. Objectives. General objective. The general objective of the study is to analyze the effect of COVID-19 pandemic in transportation industry and its level of accessibility of every individual. Specific objectives: to know the effects of pandemic to public utility vehicles owners and commuters. Analyze if it's more helpful to ban public utility vehicles to stop spreading the viruses, and also to determine the effect in transportation industry of banning public utility vehicles to operate in the past 6 months.
Significance of the study. This study will analyze the accessibility demand in public transportation services since and before the spread of COVID-19, and the results may be a great contribution in giving information for the following. First, for the commuters. Commuters are the individuals who travel using public transportation on a regular basis. This study may be beneficial to the commuters as they experience the difference of using public transportation since and before pandemic. This study may provide information on how COVID-19 changed the demand and accessibility of public transportation, in which a big factor for the commuters. Next, the operators and drivers. The operator and drivers are the most likely affected in the transportation industry by the pandemic. Revenue loss for operators and services reduction for the drivers are the main problems faced by them in order to cooperate in the containment of the virus. This study may enable them to have a deeper understanding on why the public transportation was banned. Future researchers. This study may serve as another reference data in conducting new studies. This may give them background or abstract of the implication of COVID-19 in the transportation industry.
In our conceptual framework, first, we gather data from the internet and also from the sources besides us, like family relatives who truly experienced the effect of COVID-19 on transportation. Second, we study the parameters by tricycle, buses, jeepney, commuters, and drivers or operators of public utility vehicles. Third, we also analyze the data we collect. And lastly, the summary of our study is the long-term implication and impacts of COVID-19 on public transport and shared mobility and in general mobility behavior cannot be fully assessed in the moment. But it is clear that all possible efforts need to be made to ensure that measures taken by governmental agencies, public transport, and shared mobility companies in order to ensure safety of staff and passengers, as well as a further spread of COVID-19, shall be based on comprehensive impact assessments taking into account social, environmental, and climate, as well as economic impacts.
RRL tabulation. In our study, we also include the effects and adjustment made by the companies like limiting vehicles during pandemic, and it affects the salary or income of the operators that are not allowed to operate daily or weekly. They had like skeletal force. In other study, only the operators or company make an adjustments. In our study, we will show the salary of drivers before and during pandemic and how further difference, unlike the other studies, doesn't show the salary of the drivers.
This study shows the existing problems in transportation before pandemic that could worsen since the start of the pandemic, such as places with low access in public transportation that could be a barrier for the accessibility in markets, work or business opportunities, and especially health services. After all, those problems could aggravate because of the reduction of services. Unlike other studies that shows only the current problems in transportation such as mobility reduction, financial adversity, and sustainability. Our study shows the effects of reduction in outdoor activities due to restrictions and threats of COVID-19 on the demand for public transportation services. And other studies shows only data and analysis in reduction of outdoor activities during pandemic. Research gap. This study has utilized a comparison on the degree of accessibility and demand of public transportation services through the needs of commuters, whereas previous studies only present the adjustments and reduction of services by operators. This study has an addition in modes of public transportation like jeepneys and tricycles. That's all. Thank you.